Hello, and welcome to another edition of the Burke Briefing. Today we have joining us Ms. Ursula Robinson, the President and CEO of PACE. Hello, Ursula.
Hello, Councilwoman. How are you?
I am fine. Thank you so much for joining us today.
Thank you for having me.
My pleasure. My first question is, what is PACE and why is this new center so important for older adults in our community?
Okay, great question. I always like to start out by explaining that PACE is an acronym. Okay, and it stands for Program of All-Inclusive Care for the Elderly. And that all-inclusive is going to come really important later on in our conversation. But it is a Medicare and Medicaid funded program. And our focus is on helping older adults age with dignity in the home, as well as focusing on their overall well-being. So we take a holistic approach in our care, in that we're not only looking at medical, but we're looking at social, emotional, and spiritual support for that older adult. Now, I would say why it's important to Winston-Salem in particular is when we first looked at expanding PACE, Winston-Salem was the only metropolitan left in North Carolina without a PACE program.
Really?
Yet, you have well over 3,000 older adults just in Winston-Salem that would qualify for PACE. And so why wouldn't these older adults have the same services that others have?
Okay, well, you just really highlighted a great need in our community.
Absolutely.
And you explained clearly why this is needed, much needed. So who is PACE designed to help and what services are offered? And when I say who, do you have an age?
Yeah, that's a great question again. So first of all, it is an age requirement. You have to be 55 or older. The government just requires that, okay? It's not our decision. You have to meet the nursing home level of care criteria, and that's something that we take care of. The older adult and their family does not have to worry about that. You also have to live in Forsyth, Stokes, or Surrey for the Winston-Salem program. And lastly, you have to be able to live safely in the community with the support of PACE.
Okay.
So those are the eligibility requirements. Now, as far as services are concerned, as I said, in the name is all-inclusive. So there are lots of services, and I'm going to try not to bore your audience, but just bear in mind that there are a lot of them, and I want to try to make sure I get them all.
Please do.
Okay. First and foremost, there are physician services. So we have physicians at the PACE Center. Family members don't have to worry about transporting their loved ones to see a doctor. They're at PACE. We also have nurse practitioners, nurses, dietitians, social workers, PT, OT, speech. We have drivers. I'm hoping really soon your members are going to start seeing the purple and green PACE vans around in the community. Okay. So we transport through our handicap accessible vans older adults to the PACE Center, back home, as well as to medical specialist appointments. That is another service, medical specialists. So dentists, behavioral health services, neurologists, any of the medical services that you would get outside of PACE, we provide them in PACE. And if we're not providing them, we're contracting with the health system for those services.
Wow.
And I'm not through. In addition to that, there's more. We also are responsible for the person's medications, both over-the-counter and prescription medication. We provide equipment and supplies in the home. And we have nurses available 24 hours a day, 7 days a week for questions. And then two last things I would say is that if someone needed hospitalization or needed to be in the nursing home for a short period of time, we're responsible for that. But one of the things that older adults really like to hear about that we have, and that is home care services. So we have aides who go out in the home and help with personal care and light housekeeping.
Well,
that's a lot, right?
That is a lot. And these services are more comprehensive than one might expect.
Yes.
This is just great. Great information.
Very good. Glad to share it.
You know, Ursula, many older adults fear losing their independence. And so I want to know, how does PACE help people stay in their homes and still feel safe and still feel supported?
That's a great one, too. Well, you got good questions. So I would say the first thing would be the nurse aid services in the home. You know, for those people who may be hesitant to take a bath or a shower because they're fear of falling, having a nurse aide there to help them with that is critical. The second thing that we do that I think helps support them is the 24 hours a day, 7 days a week, including holidays, that we have a nurse and a physician on call, that we're just a phone call away if you're running into an urgent situation, or if you just happen to notice that mom and dad is changing and you want to make us aware, because we believe that those small things can turn into big things, and the sooner we address them, the better to avoid that. I would say the handicapped transportation vans, so that people are not confined to their homes anymore. We're able to safely get them out to the places that they need to be. And then I mentioned the 24-hour care is important. And then lastly, I think what helps people feel safe and supported is that personalized care team. Now, we have a team of professionals that are assigned to each one of the persons that are in our program. And that team consists of a physician, a nurse, a social worker, and those other team members that I talked with you about. They meet on a very regular basis to talk about the care needs, whether it's in the home or whether it's something that the family member needs. Because family members, as you know, provide the bulk of the care to our loved ones. And so we are very concerned about them and making sure that they have the support as well.
Well, it sounds like you all were very intentional in making sure that the elderly as well as their family members feel supported, and that's very important. What makes PACE different from any other healthcare program?
The first thing I would say that makes us different is that, unlike other programs like home care agencies and managed care programs and physician practices, they focus on being a healthcare provider. PACE is a comprehensive care system. As you heard me mention all those services that we have to offer, it's very rare, if not impossible, for you to find a program that has all services under one roof. Someone said you're a one-stop shop.
Yes.
We like to say we're all in one in one program. And so I think that really sets us apart. So we're focusing not only on the clinical care, meaning the medical part, but then we have the day services for the socialization part. So we're really looking at that whole person. I think those are probably the biggest things that separate us from others, besides the fact that we are required by Medicare and Medicaid to cover all of the services that someone would receive from those different sources, even if they were not in PACE.
Wow.
No one else is required to do that.
Well, that really clarifies it, and it sounds like it is a one-stop location for all individual personalized needs that could come up. Okay. How does PACE, and you already hit on this a little, so how does PACE help to support family and caregivers who may feel overwhelmed and like they just can't go on?
Absolutely. I'll tell you what I've heard caregivers say to me. PACE is peace of mind. So for them, it means I no longer have to worry about this doctor's appointment, that doctor's appointment. How am I going to get her there? Taking time off of work to get my loved one to these appointments. And I no longer have to worry about monitoring my loved one to know that something is wrong, because I know PACE has eyes on them.
Okay.
And so I can relax. I can sleep better. My stress level has certainly decreased. And some caregivers really love the respite part of us. And what I mean by the respite is we have an adult day center. That's the Motor Road location. It's within the PACE Center. And older adults can come there during the day and participate in activities, both individual and groups. And for many caregivers, that's respite, for knowing that their loved one is somewhere safe and having a good time. Because let me tell you, these older adults have a good time. I was telling someone the other day, is it like a day party going on in here? Because that's what it feels like.
Yes.
And some days at the PACE Center. So caregivers feel really relieved to know that their loved one is well taken care of and that they've got a partner in all of this.
Well, that means everything.
It can mean everything.
It really does. And, having this kind of support as a caregiver, really, I know firsthand, could be life-changing. It means everything.
Yes.
Can you tell or share any story that might demonstrate the kind of impact that PACE can have on someone's life?
Sure. I will give the example of, we'll call her Miss Z, was at home living alone. Her daughter also lived in the same city, and she had a stroke. And as a result of the stroke, of course, she was hospitalized. and they wanted to send her to rehab for the stroke. But Miss Z was adamant about not going. She did not want to go in a nursing home, and her daughter really wanted her to be at home. So the daughter thought, maybe I can take her home for a little while at my house and help her with a rehab and then have her return to her own home. And so the folks at the hospital called PACE and said, you know, I heard this is what you specialize in. And we were like, absolutely, this is what we do best. Because had she gone to a traditional home care agency, they would have been able to give her some therapy in the home, but it would have been short term. At PACE, therapy can go on as long as you're in PACE.
Wow.
And so we were able to go into the home in the beginning because she was not necessarily needing to come to the PACE Center. So we were able to go in the home and do her therapies there. And then when she felt like it, and if she felt like it, she started coming to the day center and started seeing people who were like her, participating in activities. And we call her now our social butterfly because she greets new members into the PACE program for us.
Wow.
So that's just one of many.
Yeah, that was a wonderful example of exactly what PACE could do. If someone watching right now feels that PACE might be right for them or their loved one, what is the first step they should take?
I would say the first step is to call PACE. And that number is 336-550-4046. And I say that because no one can explain PACE like a PACE person, because first of all, it sounds unbelievable, when in fact it really is true. All those services are required by our program. And so to make sure that you're hearing about PACE from someone who truly understands it. So call us, and what we will do is we will talk about the program with you, find out what your needs are to see if it's a good match, and then if so, we'll come out to the home and start with paperwork, helping you navigate the system, because there is some different places that you'll need to go. For example, if you're someone that does not have Medicaid, we will work with you to get PACE Medicaid. And I want to make sure your listeners understand that's very different than regular Medicaid. So I don't want someone getting concerned about Medicaid. This is very different, and our team walks that person through that. And then we'll do the medical assessment that's sent to Raleigh. And then Raleigh will say yes or no to the medical assessment. And then once those two hurdles are accomplished with our support, we're ready to start serving that person the first day of the month.
Okay, well, it sounds like it's a very easy process.
It is an easy process. It just depends on what time you get the process going. So I'd say if you know of someone, don't hesitate, call immediately.
And how long does that process normally take?
So depending on the time of the month of the call, and by the time we get the balls rolling, it could be 2 weeks to a month. I have seen some people take as long as 2 months if there was some hiccups in the process. But again, it just depends on when that call is made during the month.
Okay. Well, this is a lot of great information. Is there anything else you'd like to share that maybe I didn't ask about?
I would like to share that PACE is paid for by Medicare and Medicaid. And most people who have both Medicare and Medicaid either have zero payments to PACE or a small payment to PACE. Those people who have a larger payment to PACE, they are assigned that through the Department of Social Services. But most of the times that's based on what they can afford to pay at Social Services. So I would encourage anyone with both of them to call PACE. I would also say if you only have Medicare and not Medicaid, that you still call PACE, because we will help you get the Medicaid, or we will help you work out a payment plan for our program if that's even necessary.
Okay, great information. Well, I would like to add that PACE is a beautifully designed facility on Motor Road.
Yes.
And I have been there to tour, and I just love it. I'm proud that it is in the Northeast Ward.
Yes, it is.
The attention to detail as far as the design and how it is well equipped to meet the needs that you just described and provide those services for your clients.
And can I say one more thing?
Yes.
The PACE program would not be there without you.
Oh.
You were the one that said, Miss Robinson, I have the place for you. And I thought, what is she talking about? And then when you took me there, it was just What a blessing. Thank you
Well,
for the recommendation.
My pleasure, and I do know and believe with all my heart it's going to be a blessing for this community and for the city of Winston-Salem.
Thank you.
One other thing to add, there will be a ribbon cutting
Yes,
coming up
yes.
January 23rd at the
Yes.
Pace location, which is at 1741 Motor Road, and that ribbon cutting will begin promptly at 11 o'clock. So anyone viewing this, I hope that they will be able to come.
Please
and,
have them RSVP. That's
okay.
right. And go to the website.
They have to go to the website to RSVP so that they can attend this ribbon cutting.
Yes, yes.
Okay, then, great information. Well, Ursula, thank you so much for coming
welcome.
in and sharing about the PACE
Yes, so
facility on Motor Road. We're excited as well.
Thank you.
Thank you again.
Thank you.
And thank you for tuning in to another edition of the Burke Briefing.